So good morning, everybody. Today marks 375 days since our first COVID-19 case a year ago. It's 54 weeks later. I'm happy to say that once again we don't have to report any new people passing away from COVID-19. No new deaths reported over the weekend, which is awesome. We have 21,745 cases of COVID-19 in Albany County to date. We have an increase of 50 positive cases since yesterday. We saw 71 new cases the day before that, and it was 64. Our 5-day average, our new daily positive, 68. The day before that was 67. So we are starting to see a more increase in positive cases with COVID-19, but we're not seeing the hospitalizations, which is awesome, in ICU and the rest of it, so which is also awesome. There are currently 1,233 people under mandatory quarantine. Yesterday it was 1,282. Of the positive cases, 28 had close contact to a positive case to our healthcare workers or residents of a group setting. 20 don't have a clear source of infection. As of today, 21,240 people who've tested positive for the virus had recovered, which is also awesome to point out. 47 of them increased since yesterday, which is also good. And like I was saying, there's no new hospitalizations overnight. Only one announced yesterday, which is great news. The last time we saw no new hospitalizations in a 24-hour period was back on November 26th. So there's a great story in the TU from Laura Stanford on the deaths related to COVID and the numbers going down, which we're starting to see less hospitalizations. I don't know, because of the vaccines getting out there more. Thank you to people still paying attention, but our numbers are slightly going up. And yes, a little worried with spring break, what happened down in Miami and other parts of this country, and where these kids are traveling back to. There are now 23 people currently hospitalized from the virus. Yesterday it was 25. 4 people currently in the ICU. There was 4 people there in the ICU the day before. So we had our first case of the virus discovered in the state, was identified in New York City over the weekend from Brazil. So that's one thing we got to be careful of. And the other strains we announced before that we've had here. So, we still got to be cautious. It's here. Please still wear your mask, cough into your arm, clean your hands, stay 6 feet apart, and we'll get through this. I've said this, it's been a marathon, it's not a sprint. You've got to take a step back, take a deep breath, and we'll get through all this. Working together, things are going in the right direction. We got to continue going in, because I can assure you, Dr. Will and I do not want a third wave, and we don't want to take a step back with hospitalizations or anything like that, or huge spikes that we were getting before when the numbers really start going up. So please, if you need to get a vaccine, public health experts and doctors agree it's safe and effective. For those who want to get the vaccine, you can check if you're eligible at the New York State website at 1-833-697-4829, and there's still available appointments at UAlbany at their vaccination site. And last time I checked, in Washington Armory, there's still spots there to go through there. So please look to see if you're eligible. Use the 211 number. Go through them. They can help you out. It's been a useful resource since the beginning. I know people have a lot of anxiety, trying to register still, trying to get on the list. Things are starting to open up. Like we've always said, we had the demand, we didn't have the supply. We're getting there. So be patient, and we have to wait for your turn to happen to get called upon. Our pre-registration, we've been going through, not us just using it, other agencies been using our pre-registration. Please go on there, register, even if it's not your time, pre-register, and you put in your category, and when we get to that category, I can assure you we will select you to pull you in. The people who haven't gotten contact are the ones that aren't eligible at this point in time, because I think Dr. Whelan said it better than me at times. We're stuck into a certain category, who we can vaccine, who we can't vaccine, what age groups, teachers, then it was over 65, then it was certain things. So unfortunately, unlike UAlbany site or the Washington Armory site, they can vaccine all different groups. We're tied into a net narrow of people that we can get the vaccine for, and who we can get it into their arms. But you can find at our albanycountywebsite.com. Go on there. You can see if you're eligible. If we're still encouraging people to get COVID-19 testing. If you need it, please go and get tested. If you think you're sick, go and get tested. It gives you times and slots, so please go and do that. One of the good news yesterday was people with underlying health conditions can now sign up for vaccine appointments at pharmacists, which is awesome. So people now can go through the pharmacy to get it. I just want to let you know, out of the 500 J&J doses we got over last week for homebound seniors, Dr. Whalen and her team broke it down with a group of everyone else in my office. 95 doses went to Colonie EMS. 95 went to Guilderland EMS, 10 doses went to Marra's Pharmacy in Cohoes, 25 doses went to the Eddy Senior Care Center, 200 doses went to the Eddy Visiting Nurse and Rehabilitation Association, which got it out to homebound. Great effort, great partnership, great teamwork from everybody to get this out. I know there's people waiting for the J&J because it's one shot. Please take whatever shot's available. I told you this the last time. I've talked to people that were in line that wanted to wait to take it because they want the J&J. They didn't want to have to come back for a second shot. Please, by all means, if that's what's available to you at that point in time, every shot we get in someone's arm is closer to getting rid of these, And I mean, we're probably going to be wearing these to the end of the year, but we get to that 70%. Life will get back to somewhat of normalcy. It won't ever be the way it was prior to all this, but we will get there. So some of the really good news too, we're at 32.5% of Albany County's population has received the first dose. 70s that mark we're looking for. So like I said before, every day we're checking this, every week when we're doing things. And then at least an estimate 16.4% have been completely vaccinated in the county. So compare that to statewide rate. The first dose administered, that was 25.7%. So getting a good job out there. We have pods going on this week, Thursday, Saturday, and Monday. They will be at the Capitol Center, so we are putting a notice out. People will get a text, email, because of what's going on with the NCAAs. So it will be at the Capitol Center, it won't be at the TU, but we got 1,007 doses of Pfizer for this week and 1,000 of Moderna that will get out. So 2,100 vaccines this week with pods, and which is also good news. Again, we're getting there. So please, people, just pay, if you're getting your vaccine this week, Capitol Center, think of the Capitol. White House officials have said by the end of March, beginning of April, we're going to get more vaccine out. You're going to see more and more J&J. You're going to see more of all the other vaccine that's out on the market. So it will get to the point, it will continue to open up and get out to more people. I know there's a lot of people out there that want it. I can't explain it to you, and I know Dr. Whalen can't either. We don't decide who gets on that list. That's the governor that decides what categories it's opening up to and what they base it on. I don't know. You'd have to ask them that question because we're told when it opens up to a new group, we do it and we go forward with it. And I know there's a lot of people out there that want to get it. And I know there's a lot of essential employees that are essential. Like the post office, if you look at the CDC website, they're a category 1A on a national level, but here they're a 1C. I mean, it's just, no rhyme or reason, don't know. We have federal credit union tellers, UPS delivery workers, public facing, but not eligible. I can't explain it to you. Having barbers and hairdressers who been extremely close contact. And one thing I did learn from the beginning of this, how many women love their hairdressers and how that was a huge category, and Mary being one of them. So, the fact that they're not on that list, they should be, because you know what? I've learned that people want their nail salons, their hairdressers open in their barber shop. So, but they're not on there. So I don't know how to explain it one way or another, and they had to get tested to stay open. We also know you have to be 60 years of old to be eligible at this time. We want to lower it to 55. We want to lower it to 50 because based on the numbers, and look, I'll say based on the science, what we were dealing with, people passing away from this, was 50 and above. We had people under 50, but we had that huge category within that 50. And that's why I said, let's base the vaccine on the population that needs it. And I agree, healthcare workers, 1A and all that, and it should have been 75 and above until that was done, then moved up. But For whatever reason, it wasn't. But I am advocating today to say to the governor, and again, I'll be saying that to General Murphy at the control room, 50 and above. And really, at this point, with more vaccine coming in, it should be open to people that want to get this vaccine at this time and point. But I do want to make sure we get the homebound completed and we get the people with underlying health issues get it first and foremost. So if there's someone out there, please, if you can't get on, call my office, 518-447-7040, and we'll make sure if you're having an issue that we if you're eligible, we get you there. Continue to do the right thing, and we're going to get through this. Dr. Whalen.
Good morning. So yes, the push continues to get Albany County residents vaccinated, and we are pleased to augment our supply of vaccines this week with additional shipments of Pfizer and Moderna. We will be announcing pod later this week. As we've said many times, we find out on during the weekend what our allocation would be, and then once we get it in hand is when we schedule the pods. So that's usually on a Tuesday, so more information will be coming. In terms of our second dose clinics this week, it is important to note the location change to the Capitol Center, which is going to be a great location for us to continue these second dose pods. And I think I heard this morning there was a miscommunication in the press about a Friday pod. There is no Friday pod scheduled at this time. There is a Thursday from 2 to 4:30 scheduled, and there is a Saturday from 10 to 12:30. And if you are due for a second dose, you will be getting a confirmatory email that not only tells you what time to come, but tells you the location, so that we look forward to seeing you there. As the county executive indicated, we were also pleased to get a supply last week of Johnson & Johnson, which we are going to be sharing with community partners and doing vaccinations for the homebound, which is a great development, and we hope that this is a supply of vaccines that we continue to get as things march forward. In terms of eligibility, I believe that this will be opened up in the near future, but at this point, it couldn't be soon enough. What we really want to do is be able to concentrate on getting as many vaccines out as we possibly can. So to have an expanded eligibility for some of the populations mentioned by the county executive just now will be very helpful. There are a lot of you out there in the workforce that are forward-facing that need to be covered and need to be protected. And it is important from a public health perspective. It is important from an economic perspective. It is important from a continuity of operations, continuity of life, and resumption of life as we know it, to be able to get back to the point where people feel protected and can get back into the workplace. So as those eligibility expansions increase, we will be looking forward to meeting the challenge of getting as many residents vaccinated as we can. And we know that this starts with those that are willing and eligible, but we also need to do a lot to work with people that are still on the fence about getting vaccinated. So again, I do want to share that the vaccine is safe and effective, that it is something that, I'm sure now you likely know someone who has been vaccinated. And for the vast majority of people that we see in our clinics, there's a tremendous sense of relief when they get those vaccines, when they come and they know that they are a step closer towards getting to the end of the pandemic, towards protecting themselves, protecting their families, protecting their loved ones. Because remember, it's not just you that you protect when you get vaccinated. So we look forward to seeing you either at our pod or, we're very lucky in Albany County. There are a lot of places that people can go to be vaccinated. We're pleased with the expansion of the eligibility for the pharmacies, which will give people another place where a lot of people are comfortable getting vaccinated. And there are some providers in the community that will be receiving direct allocations of vaccine this week too. And we hope that that expands as time goes forward. Thanks.
Thank you, Dr. Whalen, as always. and to everyone out there working so hard, and our nursing home employees at our Albany County Rehabilitation Center, the stress they've been under for the last year, and working around the clock with COVID-19 patients, losing patients out there, to the 15 family members that we did lose out there that lived at our nursing home. You know, again, it's been a rough year for everybody, and thank you to everyone that has rolled up their sleeves and made things possible, because without the workforce in a variety of areas, and that's why I've always said this, from water purification to our security guards, to our cleaners, it have made it possible to stay open and deliver our services, and being stressed, because it has been a different world out there, and people handle stress differently. On a good note, though, we're announcing a county-wide reusable bag art contest with our schools. Anyone knows the statewide legislation that banned plastic bags in grocery stores at a 5-cent fee. 3 cents goes to the state, 2 stays within the county for education and other purposes, for free usable bags. I want to put this out there. We got talking about this because, you know, we want to challenge our school kids to use reusable bags, make art out of them so people can use them. People that have assistance, SNAP, ETB cards, or any assistance they're on, do not pay the 5 cents. I've had people call me, which I'm surprised that kept asking that question. They should not be charged if you're using that when you go to check out of a grocery store. Your bags should be should be free. That was part of the legislation. So if that continues to be an issue, please let us know. We'll have our weights and measures teams over there to find out what's going on. But you shouldn't be charged. But this will be a great initiative for kids to use their art skills and help paint some bags and get them out there. So we want to educate the public and get community input, and let our students have fun while we're doing that with the artwork. So I look forward to this challenge going forward. The deadline for submission will be April 9th, and we'll be announcing the winner on Earth Day on April the 22nd. Please submit any of your drawings to Albany County Kids Care at albanycounty.com, and we'll announce the winners then. Hopefully we won't be doing the press conferences April 22nd, and things will get better as we continue to go on. But I want to encourage people to go to our website, albanycounty.com, to view all the different testing locations, which I talked about. Mental health support to Congressman Tonko and to the Congress for looking into mental health and looking how COVID has impacted mental health on a national level. Great legislation. It's something that we've been doing since day 2, since this started, and unfortunately, people need help. So call 518-269-6634, and any mental health issues, please call our 24-hour sexual assault hotline number, 518-447-7716. Unfortunately, them numbers been going up. It's disturbing, very disturbing, being a father of 2 daughters. And please, you have us here in the county to help out. Don't be afraid to reach out. That's what we do, to Karen Ziegler and her team. And again, thank you to everyone of all the services that we provide throughout the county. Please be safe out there and do the right thing. The light's at the end of the tunnel. Our hope is here. By giving vaccinations, sign up and get your shot.